Yes, sorry, I would like to ask more about that, but there's this new modeling from SFU which suggests that achieving herd immunity is still quite a ways off, in part because we're not immunizing children. I'm wondering if there's any consideration of changing the age for vaccines, and if you can also talk about when you think we will get to that post-pandemic future.
Yeah, so, modeling is really helpful because it helps us understand what are some of the parameters that we need to pay attention to. And then this is another one of those where there's speculation, and it helps you look at, well, which are the most important things that we need to address. What I took away from that model is that one of the most important things we need to address is getting high rates of immunization across all age groups. And that is something we're focused on right now. I know they used 80% as one of their parameters. So models are very dependent on what you put in them. So we have very high rates, higher than 80% in many age groups. And so that's why it is so important for everybody. When a vaccine is available to you, take it, whichever vaccine it is, because we know they all work and they're all effective. And it helps in preventing the transmission for you, but also to those around you. And eventually we'll get to that place where we see drop-off in transmission on a community level. And so, the models are helpful in that respect, but we also have our real-world experience that we've seen around the world. So the UK is a very good example where we have seen dramatic decreases in transmission after a single dose of vaccine at a rate of about 50 to 60% of the population. Doesn't mean that COVID is gone completely, and I think that is important for all of us. But it means that we're not having people end up in hospital, in ICU, in those high numbers. Right now, we're seeing that. It means that we can have small clusters and outbreaks that we can manage through the public health measures that we know work. So those are the things that we're looking at. And here in BC, we have a number of examples of that as well. Prince Rupert, where we did the whole of community, the amount of transmission dropped off dramatically. We saw the same with the Cowichan tribes, where we had a lot of transmission in that community, and immunization has stopped that in its tracks. We've seen it in the downtown east side, where targeted immunization has meant that we have dramatically decreased the amount of virus that is circulating in those most at risk in those communities, and that in turn has protected St. Paul's Hospital, for example. So these are all things that we know make a difference and are factored into how we're thinking through these next few weeks and months. So immunization of children is absolutely important. We know that the vaccines that we have right now are licensed, one of them, the Pfizer vaccine is licensed down to age 16. There's ongoing studies looking at children between the ages of 12 and 16, and we expect those to read out, as we call it, to be the results of those studies to come in the next few months. And as well, there are studies going down to 6 months of age with some of the vaccine candidates as well. So I do believe that by next fall, we're likely to have a vaccine available for children, particularly for teenagers who are most at risk. As we know, the risk goes down by age. So that's important, and that will help us in terms of getting to yet another phase. But right now, we know that we can get, if we get high rates of immunization, we stop those chains of transmission in our communities and get it down to a level where we're having milder illness in younger people and not having our hospitals whelmed as they are right now, that we can manage this and we can start to resume some of those activities that are so important for us in society. And I believe that we will get that to that place if we keep going with what we're doing, and people pay attention right now to stopping your connections with others, that we can get there by the 1st of July. We'll be able to start slowly and cautiously having those connections again through the summer.